Good evening, everyone. Thank you for joining us today. We are here today with a very interesting and distinguished panel of very high achievers, and I will introduce you to them in just a minute. So the topic today that we are going to address is PCOS, Hirsutism, and family support. And we will talk about how it is the importance of family support and how young women with PCOS, and especially with unwanted facial hair, what they have to deal with and how families can support them better. We are also thankful to Lupin Pharma for supporting this webinar. Quick introduction, PatientsEngage is an online platform. We do believe that informed patients make better choices, and it is our constant endeavor to make sure that through our offerings, we put out information that enables people to make better choices, better decisions. But we also believe that the information comes not just from healthcare professionals and experts, but also those with lived experiences and their own expertise of living with their experience. So that's why today we bring together again a panel which comprises of both. In the last webinar, which we did on PCOS in October, we talked of how obesity and fertility are two of the issues that affects people with PCOS. And today, as I said, we talk about unwanted facial hair and sometimes body hair, and the importance of family support. Our panelists today are Dr. Tejal Lathia, who's an endocrinologist at Fortis and Apollo Hospitals in Navi Mumbai. She is DM endocrinology and has 10 years of experience. She is also a co-writer of a topic which is very interesting, and the importance of how language matters for young people with diabetes. We have with us Rakhi Shaha. She's a senior HR executive with, I think, about 17 years of experience, strong and resilient, grateful for her life and for her family. And she lives with PCOS. Dr. Chitra, Selvan, endocrinologist and a associate professor at MS Ramaiah Medical College in Bangalore, winner of many awards. Anjum Sohail, nutritionist and health coach, also lives with PCOS. A very strong believer in focus on healthier lives and how small realistic lifestyle changes make a difference. Professor Mahati Chittem, who's a PhD Associate Professor of Health and Medical Psychology at IIT Hyderabad. And she also focuses not just on PCOS, but also cancer, diabetes, women's health, and importantly for us, health behaviors as well. And I am Aparna Mittal. I'm the founder of PatientsEngage, and I'll be moderating this session. Quick reminder, as always, to our attendees, the information that is being discussed here does not replace a medical consultation. So do consult your doctor specifically for specific medical issues. This session is being recorded. If you're logged into Zoom, post your questions on the Q&A. If you're on Facebook or YouTube, you can post the comments or questions on the live feed. And as always, you can write to us at editor@patientsengage.com to share your experience, or follow us through any of our social media pages. I think we have, I think we'll get started now. Let me first start with Dr. Tejal, who will talk us through what is PCOS and how does how do some of the bigger challenges affect them and why we are focusing on some of them. And then we'll move on to the personal experiences of Rakhi and Anjum. And then we'll move on to Professor Mahati and Dr. Chitra. Dr. Tejal, if you can just talk us through what is PCOS and how it affects women.
Am I audible now?
Yes, you are.
Yeah. So at the outset, before I start anything, I want to thank you, Aparna, for giving us this opportunity. Dr. Chitra, Dr. Mahati, and I, we are very passionate about PCOS, and all of our work, most of our work revolves around PCOS, and we are really grateful to you for giving us this platform to share what we've done. Because often what happens in medical circles is doctors talk among themselves, but the people who really are the stakeholders don't really understand what is happening. So I want to start with that big thank you. I have my eye on the watch. So in the next 7 to 8 minutes, I'll quickly walk our audience through in very brief about PCOS, what exactly is hirsutism, what are the lacunae in current care, what are the friction points that exist in current PCOS care. So there are a few things that I want to say out loud, like how Aparna had that slide where she clarified some things, and there's something that I want to say out loud. The PCOS is not a simple condition. It's an extremely complex condition, and often patients feel frustrated, or people who live with PCOS get frustrated with medical professionals. But believe me, it's a very complex condition, and it's something which even doctors have to grapple with. Science is evolving, and I'll talk in the next 1 or 2 slides how the evolution of science impacts patient care. Unfortunately, there are limited treatment options. I'm very excited to say there's a large study called the DAISY PCOS going on in the UK, which is exploring additional medications which can be used for PCOS. But yes, we have to accept that there are limited treatment options. And unfortunately, because this is a question which almost every young girl and her mother or her father who walk into the clinic asks us, is there something that we can do to cure it permanently? And I'm sorry that at least at this time in the evolution of medical science, we don't have a permanent cure for PCOS, but I'm very hopeful for the future. No, there's a lot of confusion which exists around PCOS. So a lot of my patients says, I told her, so now that we are clear that you probably have PCOS, and the patient will say, so do you mean that I don't have PCOD anymore and I now have PCOS? So I'd like to clarify that PCOS and PCOD are both terms for the same condition, which is and like I said, science is evolving. Doctors do change their mind as more evidence emerges, and PCOS and PCOD are the same thing. Now, I don't want you to look at anything in this slide, but just for you to understand that even the diagnosis of PCOS is tricky. It's tricky for doctors. In 1990, long before I even entered medical school, there was a different set of criteria for diagnosis of PCOS. In 2003, I was in first year of my MD medicine. At that time, new guidelines came. And in 2006, I was just preparing to enter endocrinology. And again, a whole new set of guidelines came up for the diagnosis of PCOS. I know one of the pain points of patients is that often they seem to think that the doctors are confused about their diagnosis. It is a tricky condition to diagnose, and criteria also keep changing. But for the benefit of our audience today, if in very short I could talk about what exactly is PCOS, it could be a variable combination of one, delayed or absent periods, clinical or biochemical hyperandrogenism. And I don't want to, clog it up with medical jargon. So very simply put, women who have excessive facial hair can have pimples, difficult to treat, or scalp hair loss. And if these signs are not there, a blood level of androgens which are high. So delayed or absent periods, evidence of androgen levels being high either in the blood or in the skin and the hair. And of course, one of the criteria is an ultrasonography, which shows multiple tiny cysts in the ovary. Now, often there's a lot of confusion, and a lot of women, just by looking at a sonography picture, are told that, oh, you have PCOS. So this is where I want to weigh in and saying that there can be variable combination of symptoms in different patients. So for example, somebody could have just delayed absent periods and the cysts in the ovary, but have no signs of any pimples or acne or scalp hair loss. There may be some women who have delayed an absent period along with maybe excessive facial hair, but the sonography picture may be absolutely normal. Or they could be women with some of the cosmetic features, the sonography appearance of cysts in the ovary, but absolutely regular periods. So again and again, I'd like to reintroduce the same concept that it's a complex condition, its diagnosis is difficult. And if you're not sure, I would strongly urge you to not self-diagnose and maybe see your doctor and discuss this out. Find an endocrinologist close to you and maybe, consult them. The reason why I put that slide is to clarify that just because there are cysts in the ovary does not mean that it's PCOS. If they're only pimples with nothing else, often the derm might say, you know what, I think you have a hormonal condition, you probably have PCOS. And somebody, it's a big thing to hit them. So they think that they have PCOS. A lot of girls who find it difficult to lose weight also assume that they have PCOS and get worried. This was a little bit about what is PCOS, irregular periods, maybe some skin and hair features, blood levels of androgens which are raised, and a sonography picture. What is hirsutism? And Aparna specifically requested that I should clarify all women have hair on their face, and all of the pictures that you see on Instagram and on the covers of magazines and in beautiful movies are of unreal women who have absolutely no hair on their face. So it's normal to have some hair on the face, but it doesn't mean you have hirsutism and PCOS. If the hair is thick, it's hard, it's short, it's dark, especially around the chin, around the upper lip, the sideburns, sometimes on other parts of the body, is what qualifies as hirsutism. Now, this is a very medical picture, and I apologize for that, but this is a way that we use to quantify hair on a woman's upper lip, her chin, on the chest, on the stomach, just below or above the umbilicus. We also quantify the hair which is there on the upper arm, the thighs, on the upper and lower back. I would like to also introduce a term which is called as patient-important hirsutism. So a lot of times doctors are very fond of scores, and if you are more than this, only then you have a problem. But we do acknowledge that even a small quantity of hair on somebody's face may have profound psychological impact on them. And that is why we use the term patient-important hirsutism. So all hair on the face is not hirsutism. If it's thick, it's dark, it's short, it's hard to touch, and it's in areas which is unusual for a woman, then that qualifies as a PCOS. I would urge you not to diagnose your PCOS yourself. And this is what Dr. Chitra suggested that I should include, because there can be some hormonal conditions which sound exactly like PCOS, but may have other things involved. And that is why it's a good idea to see your endocrinologist, get yourself evaluated, and be sure whether you really have PCOS or some other condition. Also, as Chitra suggested, we must remember, both as doctors and as caregivers of women with PCOS, it's not just a reproductive condition, it's not just a cosmetic condition, but does have impact on metabolic health as well. So it has impact on weight, on cholesterol levels, on blood sugar levels. And that is why it's extremely important for all of us to work together to understand what is PCOS, what are its symptoms, and what are the implications for a young woman living with PCOS. The last two slides, what are the friction points? And when I say friction points, I don't mean that it's patients who are troubling doctors or doctors who are troubling patients or caregivers troubling each other. It's not about that. But I think that one of the biggest issues in the world of PCOS right now is the neglect of the profound psychological impact of PCOS. Rakhi, who is on board with us today and will come on shortly, said this beautifully in one of the webinars, that doctors need to wake up to the fact that it's not just a condition which is medical, but probably the psychological impact is even greater and requires more emphasis than the medical part. So how you look, how you feel when you look into the mirror, how you feel when you walk out with the hair on the face in a social situation can have extreme profound, can have a lot of psychological impact, depression, anxiety, panic attacks, and it requires care, not only from doctors, but from caregivers, from mothers, fathers, sisters, and friends. A lot of times, doctors and caregivers tend to be quite judgmental, and we don't understand that young girls today live in a completely different world. Everything is just judged on a single photo on Instagram, and how you look is extremely important. It's also very frustrating where your friends are swigging and ordering stuff on Zomato, and you are being told to take care of your diet. You can't eat this, you can't eat that. So it's a different world. It's a difficult world to survive in. And we need to change the way we manage PCOS. And this I'm talking from doctor's perspective, as well as the perspective of mothers and fathers. There's one thing which is very close to my heart, and Dr. Mahati as well, when we were working on our paper on hirsutism, is, hormonal medicines are almost demonized. And a lot of times you read a lot of negative press on hormonal medications. I treat a huge number of girls with PCOS, and sometimes hormonal medicines are the only thing, along with laser, which work for hirsutism. So I feel very bad when I want to prescribe hormonal medicines which are safe and effective for my patient, but because of the misinformation floating around, people are reluctant or afraid to start them. My last slide, and this is something which I believe in, that it's time for doctors also to change the way they perceive patients and people with PCOS. I own up to the fact that there is poor communication by healthcare professionals. It's often a very busy OPD, very little time is given to the patient. A lot of time we tell people to lose weight without even telling them how they should do it. And then if they go on a fat diet and come back, we'll scold them that why did you do that fat diet? So I think it's time to improve our communication, give our patients more practical guidance on how exactly to achieve weight loss, what is the correct way to lose weight, what's the safe and effective way to lose weight. I think that we also spend little time with our patients clarifying their doubts about the side effects of hormonal medicines, how long they'll be needed, what is the impact on their health in the future. A lot of time, our words carry a lot of implied blame, shame, and judgment. We hold a young girl responsible for her condition and also the fact that she hasn't been able to lose weight and take care of it better. So the only way forward that I would like to say is all of us working together. And I'm so happy that on this panel today, we have healthcare practitioners, we have psychologists, we have young women with PCOS who are doing an amazing job managing the condition. Hopefully, we'll have caregivers in our audience and patient advocates like Aparna who are here to help us make this happen. Thank you so much.
Thank you, Tejal, Dr. Tejal. Just a couple of clarifications because you brought up the misconceptions around hormonal medicines. If you could clarify for the audience, have hormonal medicines changed over the years? And second, what are the common misconceptions around hormonal medicines?
So thank you so much for that question, Aparna. And it's something I strive to clarify in my OPD every single day. Yes, the hormonal medications we used to have in the past did have problems for patients. So there was some weight gain and other things involved. So I think and most of the mothers, and they're of that generation, when they had access to those medicines, so they're still afraid that, if you take those medicines, there will be weight gain. Also, because a lot of the hormonal medicines were used as contraception, the biggest myth, I think, which pervades among people is that we are giving the young girls contraceptive pills. So this is how I talk to my young patients and their caregivers. The human female body has all of two hormones, which is estrogen and progesterone. And these two hormones are the ones we use to take care of hirsutism. Yes, one of the effects is it also provides contraception, but that is not the intention of the medication. So the intention of the hormonal medication is, one, it provides regularity of periods. A lot of girls who are bleeding very heavily are able to control their periods. It's very effective with the hirsutism. It makes the effects of laser very, very effective. So yes, hormonal medications have changed. We have much safer, helpful medications which do not cause weight gain and are not used for contraception essentially. I think the biggest myth, if you ask me about hormonal medicines, is that most people seem to think that taking hormonal medications at a young age interferes with fertility at an older age. So I think that is the biggest thing which holds people back. And I want to reassure my audience and anybody who is listening to this program, the medicines that we use have a temporary effect. The effects last till you use them. Once you stop the medication, the effects wear off in 6 weeks, and they definitely do not have any permanent impact on fertility. Having said that, Aparna, you and I both know that PCOS can have impact on fertility, and probably that is where the misconception arose, that because PCOS itself can have some impact and make it difficult for young girls to get pregnant, so somehow the two things got connected. But I would like to end on a positive note that we have amazing, evolution of science, and at least in terms of fertility. And I don't think that it is impossible for anybody with PCOS to conceive. So I would like them to rest assured in that note.
Right. Thank you. Thank you, Dr. Tejal. Let's now talk to you, Rakhi. Rakhi, before we talk about your journey with PCOS, if you can tell us a little bit about yourself, because I don't want people to only see you as someone with PCOS, right? You are much more than that. So if you can just introduce yourself.
Sure. Thank you. Thank you, Aparna, for inviting me to this forum to talk about my experience with PCOD, to talk about myself, right? Well, I am a single independent lady staying in Mumbai with almost 17 years of professional career. I work as a senior director HR with a telco analytics company. I am a person who enjoys reading, who enjoys traveling, I am associated with a lot of organization to, wherever I can contribute and give back to the society. I'm a person who is very resilient in nature. I'm someone who has taken things as challenge and, changed my perspective, my perception about looking at things and how it can work, or how it can help me. That's all about me.
Thank you, Rakhi, for that introduction. So now let's talk about your PCOS journey. Tell us about your early symptoms and when did you first get diagnosed?
Yeah. So I got diagnosed at the age of 24 or 25 when I started having hair growth in the chin and neck area. It was not a dark or thick hair. It was more of a bleach color hair, and I did not have any other issues in terms of my periods or any other issues gynecologically. But I was always on heavier side from my childhood. I was always obese. So when this started, it kind of created a confusion for me. I was not sure what is happening with me. And it was also an age where my parents were looking for a suitable partner for me. So if you're already obese and then you also start having hairs at places where you're not supposed to have, that kind of thick hair, then you start feeling that something is wrong with you. You start judging yourself. You start feeling that you definitely have something wrong with you. And it also then makes you difficult to, beat the standards that our society sets for a ideal bride, like, slim, trim, beautiful girl. So I was not fitting into all those criteria. So a lot of rejections, a lot of negativities around, a lot of advices from, typical aunties, neighbors and all, you should lose weight, you should do something about yourself. All those advices started pouring in. But I was confused. I was not sure what is happening with me. And then I had some, personal responsibilities to carry on. So for almost 6-7 years, I could not see a doctor. Then I met Dr. Tejal, and then she made me understand what is the underlying reason for this and how I can, how she can help me come out of it. So that's where my journey towards recovering from PCOD started.
So tell us a little bit as to, what did your treatment entail, and what, beyond the treatment, what else did you need to do?
So obviously, what I feel is treatment was, Dr. Tejal had prescribed a hormonal pill for me. Apart from that, I have never been on any other pill. But he explained to me that there is no point in rushing for a laser or something, because even if you do it, it will come back. It will not be effective. So first we have to, treat the underlying cause. We have to treat the underlying reason for this. And then you go for a laser and it will become much more effective. So, so apart from the medicines that I have been taking, the hormonal pill I have been taking, I have recently done the laser treatment as well.
Okay, and that has been effective?
Very effective.
Okay.
And the doctor I went to was also recommended by Dr. Tejal, because she knew what kind of, treatment I will need, or what kind of doctor I will need who can make me understand, because I can't just do something for the sake of it. I have to understand the logic behind it. So
correct. So before you managed to find the right treatment, etc., you went through a few years of struggling with hirsutism and obesity. How did you handle those years?
Those were difficult years, Aparna. Obviously, I went through a phase of depression where you start doubting your confidence. You start having self-image issues. You start feeling, you start having this inferiority complex. Okay. So for example, whenever you go for any social functions, or, you see your cousins younger than you getting married, you see your friends getting married, you start attending functions where, the only thing that you get advice is, lose weight. Why don't you lose weight? Or, what are you doing about your face? I had no other. I didn't have any pimples or anything like that. It was just the hair. Now, how many times you can always go to the parlor and do the quick fix? It is not possible to do it every time. And it is painful. Anyone who has done waxing of chin and neck area can understand this. It is painful. It is not easy. You can't find time every time before any function to do that. Secondly, I am at a well-placed scenario when it comes to my professional life. But every time I used to get into a meeting, or say I used to have any sort of discussions, uh, instead of just focusing on my contribution from a intellectual point of view, I always had this doubt in my mind: are they looking at me how fat I am? Are they looking at me that I have this hair? Even when you go to parlor, you think, are they laughing on you that you have to get vaccine here and not the normal vaccine? You keep doubting yourself at every phase, whether it is your social life, whether it is your professional life. It kind of impacts your confidence.
Mm.
It impacts your dreams in a lot of ways. So that is what I have to say there.
And did you take along a friend or a family member when you went to the parlor? Because as you said, sometimes in these parlors, we all know that they can be fairly judgmental on various aspects, right? So
Not only parlor, Aparna, I think everywhere we get judged.
correct.
If I enter a room, or if I go for any forum or anything, the first thing people are going to see is I am obese, right? That's the first judgment anyone is going to pass. So anyways, it is difficult. So I typically used to have my friends around, but never family member. I stay alone. So
Right. And in terms of, your being on the heavier side, did you try, various diets? How did that
yes.
experience,
Yes.
what was your realization with that experience?
So I tried every diet that was available. I have joined almost all the gyms, and I used to put 100% effort, whether it comes to my diet or it comes to my exercise routine and all. And a lot of time it used to happen that people who used to start with me, they used to get better result, where I used to struggle, even to lose like couple of kgs. And in spite of giving 100% of effort, if you don't see the result, you are not able to understand where are you going wrong. uh, because if you have put everything and every available option in terms of exercise, diet and all, then where are you going wrong? And that used to create further frustration. Then I used to fall off the wagon, and I used to not do those diets or not do those exercises, because anyways it is not making a difference to me. So why should I bother about it?
So just a clarification to Dr. Chitra or Dr. Tejal, is it more difficult for persons with PCOS to lose weight?
Chitra, you want to take it? I'll answer. So this is something which I feel very sad about also sometimes, and it's absolutely true. Two girls both putting in the exact same effort. In fact, most of my girls with PCOS are probably more sincere than anybody else. But yes, the amount of weight that they're able to lose, commensurate with their efforts. Yes, the weight loss will be limited for girls with PCOS. The other thing is that it demands a lifetime of watching what you eat and exercising. So it's really a heavy burden for a young girl to bear. And I often think that doctors as well as caregivers don't understand the frustration and the anger they feel that it's okay for their friends to eat and they need to watch what they eat. They gain weight easily, and it's also more difficult for them to lose weight.
Right. Coming back to you, Rakhi, you talked of family and going to weddings, etc. Are there other aspects of the social isolation or the social rejection that you want to kind of, highlight?
Yeah, I feel, especially at a teenager's age, right? You have all this expectation that, you should have a partner, you should have a boyfriend or somewhere. And, you see people around you getting partners, whereas you are just being looked down because you are obese or you have facial hair. So you kind of feel rejected. So apart from all these functions and all, you also feel, you start doubting your worth, that am I not, worthy enough for anyone? So that also.
Right. And anything else that you'd like to highlight before, you kind of also give anybody out there who's young and with PCOS, who's struggling, any advice?
Yeah. So I will suggest, I can give only 2 or 3 points which help me. One is trust your doctors. Okay. If they are understanding your situation and telling you something, don't doubt that. Google is not a doctor. There are doctors for a reason. Second, accept it. The sooner we accept that this is the situation with us, the quicker we will find ways to overcome it. It takes a lot of time to accept the situation because there is so much of social stigma around PCOD as well as obesity and hair and all that we try to reject it. No, it's not possible with me. So the sooner we accept it, the quicker we will find ways to beat it, right? And the final advice I can give it to anyone is invest in yourself. Just, obesity or hair is not the end of the world. There are other good things about us. We need to invest in ourselves in whichever form you want. I mean, either there are some hobbies that one has, or there are some professional aspects that one want to focus on. Invest in yourself. That is what I feel helped me.
Right. Thanks. Thank you, Rakhi, for taking the time. I know that you
Thank you.
Might have to leave a bit early. Anjum, if you can turn on your mic. If you can introduce yourself again, first introduce yourself as a person.
So, hi, I am Anjum and I'm a nutritionist based from Bangalore, but I'm also a mother of 2 young boys, and I'm born and brought up in Bombay, but my company, I'm the founder of this company called Reset Nutrition, and the whole reason of coming here on this platform, connecting with Dr. Chitra, Dr. Tejal, and you, Aparna, basically, because I've lived my life with PCOS from a very young age. So today when I meet young girls at 21, like Rakhi said, 24, 25, and I'm like, it was too early for me. I was just 15 years of age when that hit. So I have a long story to say then.
Right. So start with what happened when you were 15 and how were you first? What were your early symptoms?
Yes, so I was still in a school and honestly, there were no symptoms, not much of facial hair or obesity. But the only thing I still can recall is I was the most inactive child in the class. I would hate even the physical training sessions. I used to be so I was known to be the quietest girl or the most introvert girl in the class. And the only symptom I would say was I had a little paunch on my tummy, which I felt in my ninth and 10th grade. Maybe I felt because, like they say, if you eat rice, you get your tummy out, or you have that little paunch, and that's what everyone said. And I'm like, okay, I'll cut down on rice. But I never knew that I was carrying a small cyst which grew to a size gradually of 10 centimeters big. And one fine day, it just starts with, pricking pain, and it's unbearable. And within 2 hours, you are heading for a laparoscopic surgery because that's the only option available. Now, this is, I'm talking about maybe 2002 and 3 when PCOS was not common. I have honestly never heard about it, or my parents were totally unaware of it. So going through a surgery at this age was definitely freaked out my parents, and they looked at PCOS more like a cancer, because what we got as a sign from the doctors were not very good. And imagine taking oral contraceptive pills at that age, where still in an Indian society, like rightly Dr. Tejal said, taking oral contraceptive is not only to treat your hormones. I mean, the mindset could come that, okay, this is a contraceptive pill at the end of the day. Why is a 15-year-old girl taking it? I remember hiding it and taking it because we had boys brothers or fathers. You're not comfortable taking it because you find flaws in yourself, but you're like, okay, there's something wrong with me. And after 2 years, I am again diagnosed with a very bigger cyst, which is 16 centimeters this time. And I go through the whole process again. So obviously this took a toll and a lot of my time, because this was my board exams, and it took me a 1 month to recover. And again, I was again on a 9 month for the OCPs. So trust me, at this age now, after the deliveries of 2 boys, when I go to meet a doctor and they tell me, will you take the OCPs? I'm like, I'm done with it. I started at 15 years of age, so not doing it anymore. In college life, yes, facial hair, black big acne marks on my face, meeting every dermat I knew or anyone would recommend, avoiding anything that can affect or aggravate the issue, but not having a clear idea as to what I'm going through. Because the doctors I met there for my surgeries were extremely senior doctors, and I like Dr. Tejal said, the OPDs are full and you guys don't have time for it. But as a 15-year-old, I would have expected a little more empathy, time, or some explanation as to what I'm going through, on what should I expect in the next 1 year or 2 year, in terms of taking precautions. It is definitely a hormone disorder, which is not just limited to taking medicine, finishing it, and doing the follow-up, right? There's a lot to do. So imagine I come back home and I'm not doing any precaution in terms of lifestyle management, but I'm just taking the pills religiously every night just before bedtime for that clock 21 days, and you dare miss it. So it's a reminder for you to set in. And I always knew that fertility will be an issue, because that was the only take back message that we got. And that's another thing which actually affected the mindset of my parents. They were very clear that I have to get married at an early age, because my fertility issues will be bad compared to anyone else suffering from PCOS. Like I said, I never had missed periods, or I never had obesity as a concern, but the fertility thing was, that I came back home with. That was the only message that I got from the doctors that needs to be highlighted.
Right. Yeah. So I think, I think that's one of the things that, you said the doctor basically made a big message about fertility. And I guess to some extent, Rakhi, you were also kind of given that message, right? That you better get married soon. So the pressure to marry before things get worse seems to be like a big message that women with PCOS get from even healthcare professionals.
And what I feel, Aparna, is although PCOD is a common disease among women, there is not a lot of information that is available for us to look into or get information at the right time.
Right.
If we would have known a lot of things at that time, we would have taken steps well before it would have become worse, right? So a lot of doctors used to just say, you have some hormonal issues, lose weight and hormones will be fine. I know I need to lose weight. That's as clear as anything that can be to me. But how do I do that? It's something that nobody could understand.
Right. And Anjum, you were kind of literally had to rush into marriage. How did that affect your life? You had aspirations, dreams.
To be a doctor, maybe someone like Dr. Tejal or Dr. Chitra, but I don't regret. It was a rush, and then I got married at a young age. I still wanted to study, and after getting married, I pursued my master's, which was in dietetics. And while pursuing my master's, I conceived and I delivered at the age of 22. So when I scroll through Facebook at that point of time and I see my friends holidaying in France or applying for their MBA or just living their life, and I used to have this thought or depression and breakdown sessions as to what am I doing with my life. I have a crying baby on my lap. I don't know what to do, and I'm changing diapers. I'm still trying to finish my master's somehow. It's not easy because I see one after the other, every door closing, and I've been always ambitious, very career oriented. I wanted to have a balance of both. And my friends, my families used to call me, you're crazy, you can do one thing at a time. You can either be a good mother or a working woman, you can't have both. But I knew I could. Why not? And I wanted to do it against every odd. So that time definitely was very difficult, but I survived, and I'm glad that I chose dietetics, and I'm glad that I'm practicing it today. Because when I meet girl of age 15-year-old suffering from PCOS and taking oral contraceptive pills, I literally handhold them through the situation, because I myself have gone through all of it. People making fun of those upper lip hair, or worrying about my weight issues, or having those black acne marks, and running with every dermats that I knew, or using all the creams that everyone posted on Instagram or Facebook, those ads. But at the end of the day, it's the hormones that are affecting, and you don't have that awareness, or you're not aware. Rightly, Dr. Tejal said, you live with PCOS, you cure it for a while, but of course, if you go back to doing what you were doing, you will have it coming back, right? So when people come to us at our clinics, they're like, okay, we are doing it for 3 months, but what after that? Like, can we go back to living and enjoying and eating, or no, that's not possible. I mean, you have to, Rakhi also said very clearly, the earlier you face the situation, or you understand and you accept it, you start loving yourself. So I think that is what is more important right now, that you accept the fact and make 100% change for your lifetime, not for a day or 2 or 3, because PCOS is not something that you can get over it very easily. So with right medication, right lifestyle changes, it can make huge difference.
So you had 2 children, right, Anjum, as you said. Question for the doctors, or maybe first for you. Did you develop gestational diabetes? Because that's another worry that comes up for young women with PCOS when they get pregnant.
I never had issue with my gestational diabetes, but I was slightly hypertensive in the last trimester of my first pregnancy, which was worrying me at the same time, because it was terrible pedal edema. And, I remember I wanted to so desperately go back to mom when I'm pregnant. And these guys at the airport stopped me saying, my face was swollen, my feet is swollen. And I'm like, what are you guys doing? And they had a checkup done there, and only then I was allowed to fly, because my blood pressure was extremely high. And surprisingly, when I meet a doctor in Bombay and she tells me your blood pressure is high, I'm putting you on medication, it's not safe. And I remember asking her, can I ask why? And she told me, that's not my job to do or reply to you, I don't have so much time. Aparna, I was 22. I came back home, and I think I have cried for 3 nights and days, because I was like, where am I, Mama? She's not a good doctor. I mean, at this point of time, I need someone who really understands my situation and is being very, very supportive. But unfortunately, we didn't have option, and she was a recommendation. So we went through the whole procedure. But the second pregnancy was also absolutely normal. I never had a concern with gestational diabetes, or again with hypertension or anything of that sort.
Okay.
Aparna, could I add a comment?
Sure.
So probably, unfortunately for Anjum, but because she was very young, so that's why maybe the gestational diabetes didn't show up. And, when women are older going into the pregnancy, heavier going into the pregnancy, then the gestational diabetes may show up.
Right. Okay. Yeah, and Anjum didn't have as much of obesity or a weight gain problem, right? So probably that helps. Thank you. And, Anjum, any message to young women or their families watching this show?
I would say something very similar to what Rakhi said, because I think we all say the same boat. You have a lot of options available on Google in today's time. You have advertisements on Instagram, which is insane. And, then a common man gets confused as to what options are right. But trust me, if you are with the right, doctors and your, health coaches, just go with the flow. There is no stopping. You can bounce back, you can lose weight, you can look beautiful. Like Rakhi said, just invest in yourself in the right way. And if you do it, I swear I'm so proud that I live with PCOS and I can still do so much. So there's nothing that can stop you. You should not feel, a part of you is affected or there's a flaw in it. I mean, you never know. Sometimes I have so much to talk in my counseling sessions, because I actually tell this story to my clients, and, they actually can feel it. So you never know which story of yours can motivate someone else, and they can, it can just change the whole situation.
Sure.
So find the right people, trust them, and invest in yourself is again what I would say.
Thank you, Anjum, and thank you, Rakhi, for coming forward to share your experience. I'm sure it will be really helpful for so many others. On the question of, what's available on various social media, etc., is there a recommended diet? That's one of the questions we've received as well. Is there a PCOS diet that works, or is there a diet that works?
Can I take that?
Sure.
Okay. I think the number of sites or books that are being written about PCOS specific diet are many, and it's very easy to be, swayed by it. And there are a lot of molecules, let's say tablets or supplements, which are being pushed to maybe reverse PCOS and make it better and all of it. But where there's very little evidence towards any specific diet, very little evidence for any specific supplement, be it inositol or chromium or zinc or magnesium and all of it. So overall, it just helps to stick to natural food, including more vegetables. All of our diet is deficient in protein. Consistently working towards increasing protein intake every day and reducing the amount of processed food, first of all, eliminate it as much as possible. It's very, very difficult. It's difficult in the 40s. It's that much more difficult in your work towards reducing your carbohydrate portion. That's all. And this is the same diet, if you see, which works for type 2 diabetes. It's the same diet which works for all metabolic disorders. So there's no specific thyroid diet or PCOS diet. So I want to put this out there very clearly.
Thank you. Thank you.
Can I add something to this, please?
Sure.
The moment you cut down the processed and packaged food, just like Dr. Chitra said, half of the job is done. And like Dr. Tejal said, in today's time of Swiggy and Zomato, the access to food that's available and the options available, and people don't realize the excess calorie that goes into the system and the inactivity pattern because of a sedentary lifestyle. We are too busy with our 9-to-5 jobs, and we are indoors all the time, Netflixing on weekends. So we are never in a calorie deficit zone. You are always in the surplus. And of course, an Indian diet is extremely rich in carbohydrate, which again causes the problem because the surplus of carb intake, processed food, sugar, and the options are unlimited. Just cutting down on the processed food, sugar, or excess carbohydrate and trying to be in calorie deficit, then even if you can manage to have a biryani in a calorie deficit diet, it works wonderful. So there's no restricted diet or no formula that's written, okay, this is equal to, getting rid of PCOS. Absolutely no. Good workout routine, good activity pattern, clean eating, homemade food. People fear fats is another thing I've seen, but PCOS always I've seen, the result has been so good when you do good quality fat in your diet. That's your ghee, that's your just homemade pure ghee. So that's amazing. That's, something, a combination of these things will work wonderful.
Thank you, Anjum. Professor Mahati, you did a study on, and you spoke with young women with PCOS. Can you talk to us about the study and your findings, in terms of the emotional challenges faced by young women? Yeah.
Okay, so first off, I want to start off by again thanking you for kind of giving us this opportunity to share the work that we've done. And I also want to thank, our research team, because we could not have pulled something off like this without the support of every single person who journeyed with us. And I also want to kind of contextualize this, that, the way that we kind of came together, Chitra, Tejal, and myself, was because we were propelled to understand how doctors are communicating with their patients, because that has a very long-lasting effect in terms of outcomes, So like Anjum was saying, right, when she's 22 years old and she goes to a doctor and the doctor says, it's not my job to tell you, I don't have the time for this. It has a very scathing and very long-term effect on the person. So I had gestational diabetes, and I remember the doc looked at me and said, you're going to need insulin injections. I was 15 weeks pregnant, and I said, why? And then he said, well, because you're at 15 weeks, you have GDM. And I remember I went to a point where at 27 weeks or something, I didn't even need the metformin he was giving because I was like, yeah, challenge accepted. So, you know, what kind of propelled us was to understand that, you know, to understand where is this coming from. But, you know, in that journey, we also wanted to understand what is it that the patient wants, you know. So today I will be talking about that part. We're talking about the women who have PCOS and hirsutism, right? So it's like already a layer upon a layer. So we interviewed 27 women, and they had an average age of about 22 years. And of them, we also interviewed 12 of their mothers who were at an average age of about 50 years of age, age. And today I will only talk about what the women had revealed to us. Okay. So, you know, one thing that was like, you know, it just kind of like struck us when we looked at all those transcripts and I listened to the recordings, was that they talked about harboring very strong feelings of shame. And that shame sort of led to issues around self-confidence and self-doubt. So a lot of what Rakhi was talking about, right? So it was reflected in our data. The effects of shame were so elongated and so deep as well in their lived experience in their daily life, that had the strongest knock-on effect of those feelings of shame was on self-confidence. So the low self-confidence was not something that they were grappling with at a very, it's not just self-confidence, right? It gets expressed in so many, you know, aspects of life, right? So how you talk to yourself, how you talk to others. And like Rakhi was so eloquently had put it, right? So you're constantly wondering about yourself. And so then, you know, what was interesting with our participants was that they were talking about how they were constantly looking for a solution. So that was actually very encouraging for us to read, you know, but there were individuals who were constantly looking for ways in which I can address this issue of hirsutism, because I think hirsutism is the problem. Right. You know, and so from a scholar's point of view, I would say that actually it's the people's perception that is the problem and not the hirsutism. But, you know, that's for another dialogue for another day. And so what we did was, I mean, I wanted to read out one quote that kind of summarizes the emotional challenges that young women experience. You know, one participant told us, I felt a little uncomfortable thinking I am not living up to, or I'm not beautiful. This is not how a girl's face should look like with so much hair. I felt quite unnatural. And that, I think, really summarizes, you know, what it does to one's identity, you know, and sense of being. And so when we asked them, you know, what kind of support needs do you have, and, you know, who do you reach out to? Largely, they spoke about their friends in that, but it was, even though they did talk about their friends very quickly, they talked about it more like, you know, I had to kind of I can't educate everybody, so I'll educate my close friends. And right. I'll enlist their support, and I'll tell them that, you know, this is the stuff I'm going through. But, you know, they talk about it in a way like, you know, one of them said, I just laugh about it and told them, and then I cut the conversation. So they're sort of like, you know, kind of getting them to support them, but not fully. But the issue over here that was interesting for us was they spent a lot of time talking about what they wanted from their mom. Right. And that was very central to us, you know, more than even the physician. They were talking about how they wanted their mom to support them, right, more than even their friends, although the moms were thinking that they wanted their friends to support them. So there were two fundamental areas that they wanted support from their mother. One was around empathy. And so they wanted, when I kind of like was looking at the data, what kept coming up, and like, what does empathy mean? Because all of us have different definitions at different time points in our life, right? What they were talking about in terms of empathy was they wanted their mother to help them make sense of their feelings. So, and this is an everyday affair, mind you, right? So they want their mother to, you know, if I'm constantly touching the hair on my, you know, chin, don't tell me to stop pulling the hair on my chin. understand why am I doing this today? Am I doing it more today, than I did it yesterday? So kind of sieve through those emotions, right? So if I'm coming home dilapidated, I want you to kind of process that emotional journey with me. All right. So that's what they wanted. And they also, in that quest, they wanted the mother to also not normalize what they're going through. So what they came across was, and this was particularly apparent in our participants who were of Sindhi origin, was that the mothers, and South Indian origin as well, was that the mothers would say, like, we're all hairy. This is normal. So they found that very problematic. They didn't want to normalize it, because normalizing it means you don't do anything about it. But that's not what they wanted. So they didn't want that. They didn't want a mother who was extremely engaged and was telling them, go do this, go do that. They didn't want all of that. They wanted a mom who's there with them to process these emotions that they experience. They also wanted a mother who was proactive. Okay, so there was empathy, and then there's proactiveness. Now, our participants wanted a mother who was like a decision-making companion. So now what I mean by companion is somebody who was traveling with them, but was not making decisions for them and with them. So this was more of at some point, it can be a sounding board. Sometimes it can be someone who gives advice. Sometimes it's someone who walks with them to the parlor. So we had one participant who said, I want her to accompany me to the parlor. And it was such a practical reason. So she says, mostly she comes along with me because I don't like going to the parlor by myself. So I need some other person to look at me and tell me how many hair are left so that it is clear. So it makes me feel more comfortable when she's there with me. So it's a very practical, issue that she wants the mother to come and solve, because she can't keep asking her friends to come every time. So, so she says, I think that is true support, and that is what I want. So, so there is a smattering of, physically being there. So practical support. There's a bit of, helping sift through the different choices that they have, laser, waxing, and all that.
Right.
And they also want somebody who, is able to sort of become their sounding board. Okay. So I want to summarize what I've just said. What does this mean to us, going forward? Because Tejal, Chitra, and I are on this really long journey together where we want to kind of make sure that we advocate for women's health in a more constructive and helpful way. One is that women have a lot of agency. They don't want to be the victim. Okay, so having hirsutism is not a reason to be a victim any longer. And that was very apparent in their solution finding efforts. Second thing is that they have a lot of clarity about what their needs are, which needs are unmet, and how they can be met even. So that's a very big deal. And that is something we need to harness. The last thing that we had taken as a take home was their openness to seek the support, right? They're willing to work on attaining or, getting the support that they need, and they're willing to look out for it. So these are very, very helpful, very encouraging findings that we want to kind of work off on. So I'll stop at that.
Right. One clarification on that. You talked of them wanting empathy. They're clearly also kind of exerting agency and defining exactly what they want. I also come across, do you see a lot of, because in a couple of conversations I've had, there still seems to be a little bit of self-blame. Do you see that as well? Because, people will still say that, I wish I had exercised more earlier, or, I wish I hadn't done this, or, I wish I had. So is that, a realization, or is that self-blame?
So that's interesting that you bring it up. Now, what I see, so we've done, what I presented and discussed today was about the hirsutism, but in the PCOS kind of questions, yes, there are some participants who do talk about, this wishful, I should have done this, I should have done that. And, a lot of it can be attributed to self-blame rather than realization, because if you think about it logically, they did the best they could. It's not like they asked for this, right?
Mm.
So there is that. And it's also about how that weight is being perceived, right?
Mm.
The same thing with hirsutism. It is how it's being perceived.
Right.
It's this
Right.
narrative, like Tejal was saying, this narrative of this goddess, basically, you know, and then that being completely challenged. There is also a lot of stress about marriageability.
Mm.
So it's not about the weight, it's about what that weight means.
Right.
Right?
The
And it
societal
means,
consequences of it, right? Essentially.
exactly. So it's about those consequences that we're talking about. It's very problematic because
Mm.
I think we need to change the narrative of a community itself around what is weight and what is desirable attributes.
Right. Right. Thanks, Professor. Dr. Chitra, you know, again, in your experience, what have you found as effective ways of families and maybe even mothers more than other members of the family supporting young women?
Thank you, Aparna, for doing all the good work that you're doing, and thank you for engaging with us and to share some of the insights that we've gained by working on this particular topic. I think young people need all the support they can, with or without PCOS. Adolescence and young adulthood is very difficult as we are navigating changes in our mindset, in our physical body, in how we come to terms with the individual, decision-making abilities, defying, authority, all of it. It's a very turbulent time. So young people need all the support, with or without PCOS. Young girls need much more support, right? So thereby, if you are a person who's living with PCOS, and if I were speaking to Anjum, maybe when she was young, I apologize for everything that you went through. Okay. I think we didn't know better. Yeah. And to all the young girls, when you have a hypercritical mother or a critical mother who thinks that she needs to remind you 10 times a day to eat better, to exercise, let me tell you that she's coming from a place of good intention, and she doesn't know the right way to do this, but she's doing it only because she's worried sick about you. And she carries, I think, some amount of guilt, and she maybe in some way holds herself responsible for maybe passing on the genes, right? So it comes from that place. That's the only thing I want you to take back about your mothers and what you want from them back. If you are a family member who has or is a friend or know somebody who's living with PCOS, please know that it is not at all easy to live with. Not at that age, not in your 40s, right? I come from a family with a strong history of PCOS, but my early 20s and 30s were very easy, but this has been a decade that I'm struggling with, right? And you know what it is. You won't understand the struggles of it if you've not experienced it. So there is a new drug which is available for obesity, which we were conducting trials in, right? And one particular patient who struggled with weight all her life came back completely broken after she went on the drug. And she said, what this drug did was it completely removed the need for constantly looking for food, because I'm continuously just looking for the next thing to eat, and with that urge comes the urge for me to not do that because I'm gaining weight and I'm destroying my blood sugars and all my efforts. So every single time I'm just going back and forth with my mind, telling myself to stop, and then sometimes I fail, and then there's this whole spiral of guilt, and sometimes I do well, but most times I don't do well. And she's like, this drug, what it did was, now I know how those people who don't have to struggle with obesity feel. It's like my mind just got completely clearer and there's so much mind space. So I don't think we will ever understand what's happening in the minds of a person or the struggles that they go through as we all try to battle obesity, right? And I think that's something that all family members need to understand. Just because you don't have the craving to eat something sweet after dinner doesn't give us the right to ridicule the person who's struggling with that to go. They have their own reasons, and has been highlighted by everybody here. It's a completely different world. Like Mahati wants to highlight that this is a world which is wrongly placing its emphasis on looks, but this is the world that we live in. It's a vain world. It's a very, very, all arc lights are on you all the time. There is no opportunity or scope for you to look bad, not in one photograph, not in one appearance. And it's an extremely difficult world to live in as an adolescent, right? So I don't think we ever will understand the pressures of being a high school child in today's world, or a college going child in today's world. So you don't have to understand everything. You don't need to understand everything. All you need to know is that you need to be there for the person who's living with PCOS. And much of this need to support is because we have the control for access to care, right? As parents, if you believe that laser therapy is an indulgence and not something which is going to affect the well-being, the emotional makeup of your child, which in turn will have numerous repercussions on what they do with their life, their efforts towards improving their health. If you look at it that way, and if that's the worldview which your doctor endorses, and if you're going to go down that route, that young woman does not have access to improving her, her issue with that is concerning her. And that's exactly why you might not understand why we need to go through 20 lasers sittings, which are costing 5,000 rupees per sitting, and ye to kuch paisa waste kar rahe hain. We don't need to do that. Our job as parents and family members is to just support, even when you don't understand it. And as Tejal has highlighted, you might not understand what OCPs do, but if you have a sane doctor, as Rakhi and Anjum have pointed out, whom you trust, then that is what you do. And that is all, as Mahati has highlighted, is what the girls are looking for. So I think with that, I'll stop. And I'll hand it over to Aparna.
Thanks, Dr. Chitra. Couple of points that have come up. One is because you also brought up the point about the guilt of the mother. So is PCOS hereditary, or is it a lifestyle disease?
Yeah, so I think the answer is in the question, Aparna. I think it's a very poorly understood condition. There weren't as many women with PCOS, even as early as, let's say, 100, 150 years ago. So it's definitely strongly affected by environmental changes, but we do know that it affects only one group of women. So maybe if you have the susceptible genes, and you are put into an environment like the one we are in right now, we get PCOS. And how do you identify if you're susceptible? If you have a family member who has type 2 diabetes, if you have a family member who has hypertension, if you have a family member with heart disease, then you're likely to be from the gene pool which is susceptible. Because you do have young girls who are leading the same lifestyle, eating out every day, not sleeping enough, not exercising, completely having very normal cycles, not having any of the features of PCOS. So it's a bit of both. Right.
Dr. Tejal, you want to add something?
Yeah, and just that, Chitra, what we are taught in medical school, but we often forget in the clinic, is 50% of PCOS girls are not overweight. It can't all be lifestyle. So that's where I come from, is how can we blame girls with PCOS when there are some who are so thin? And unfortunately, I have to confess to this, even these girls are told by doctors, lose weight. Now, these are already thin girls and there is no weight to lose. So lifestyle could be a contributing factor, but it's complex, as I said, and we need to leave it at that. I often feel, Aparna, this is one point I wanted to make. A lot of time is wasted on finding out why. And because that entire process of finding out why I have PCOS, you spend so much of time and energy rather than focusing on what you can do. And this is what Rakhi and Anjum both said. The start of the journey is acceptance, and sometimes there may be no reason why. And I think the doctors struggle with this. They struggle with saying, I don't know. And I'm very proud to say I don't know to my patients in every clinic. Sometimes I don't know the answer, and it's okay not to know the answer. But now that you have this condition, let's work together of how we can make it better for you.
Right. We've talked of the role of the mother. is there a role of the father?
I have stories to tell of judgmental fathers. So the most recent story is of a very young girl who cried in the entire consultation because her father is a sportsman who's lean, and she's a young girl with PCOS who struggles with her weight every single day of her life. And every single day her father would tell her, look at me, I'm so fit and active. Why can't you be like this? So I think daughters, I have a special bond with their fathers. And I think it's also a lacuna in our part that we don't communicate with fathers more. I'm sure if they understood what the young girls were experiencing, then they would be much more empathetic. But sometimes, and Chitra, it's very rare, right? That usually it's both parents who come in or the mother and the daughter who come in. It's very rare for them to come with their fathers.
Sure.
Maybe we need to do more work on this.
And even if they do,
But have you, sorry, go ahead.
sorry, and even if they do come in, they want to stand 2 steps behind and maybe watch dispassionately as much as they can. Yeah.
Because these are female issues being talked about, right? But have you come across, I know Rakhi's gone, but she had mentioned how her father always said that she was beautiful. So I think that helped her in terms of, feeling accepted. And I guess that's one thing that fathers can do, right? If they do need to support their daughters, because as Dr. Tejal said, it's a unique bond, and that support from a father is essential. The other question that came up was on exercises. I know somebody asked about diets, but is there any, again, what exercises work?
Chitra, Aparna, through this webinar, I'd also like to communicate 2 things. And what I've heard from everything I've heard today, I think there are 2 pressing needs in the world of PCOS. One is we need to come up with some kind of informative website or something like that, where we can tell girls about PCOS in a simple manner and help them. But I think the answer to managing weight in polycystic ovary syndrome is multidisciplinary. It has to involve a nutritionist, a physiotherapist, and a psychologist. And I was very lucky to be part of a program which we called as Heal PCOS. And in Heal PCOS, what we found is the psychologist's role was actually the most important. Teaching young girls how to deal with body image issues, how they feel about their sexuality, how they feel about their cosmetic appearance. So I think for anyone to successfully lose weight in PCOS and maintain that weight loss, it has to be a multidisciplinary approach. It has to be a nutritional intervention which is sustainable, and has to have a psychologist on board, without which it would be incomplete.
Right. Professor Mahati, I know you talked of, young women want their mothers to help them understand their feelings, right? And that's often mothers are not trained to that, right? So as a psychologist, what is your advice to mothers? How should they be responding to, because often mothers get into problem solving. So how do they help them address their feelings and not try and kind of, get into problem solving?
Okay, so that's a very difficult question, okay? Because I'm a mom and all I can do is problem solve. So
that's why I said as a psychologist.
So you see, one thing is it's a classic technique, right, of active listening. So it's really important to listen. I mean, it's a cliche thing, but to listen for the sake of listening and not for the sake of responding. So to be able to kind of look at your kid as a kid and not your kid is something that one needs to practice. The other thing, I mean, see, I can only talk about things that I've actually tried out and I've succeeded, because otherwise I'd feel like a,
hypocrite.
like a fake. Yeah, I get exactly like a hypocrite. So one is, it's really important to practice mindfulness, to become very, conscious about what we're saying and to reflect on it. The other thing that could really work, as I said, I mean, the more we do mindfulness activities, the more we begin to be able to kind of be present and engage in active listening. The other two things that I know really help, and because I have a young kid who is going through certain, she's going through certain experiences, right, which can be attributed to some degree to hormonal changes. So is, when to have a summary of the day, right? So in the end of the day, during dinner time or something, to be able to sit and summarize the day and understand, if there was a blow up, then how did that blow up happen? Like I was saying, that my younger one lost the keys, right? So I've sat with her and we had a detailed discussion about that experience, and I assured her, certain things. The last thing that I know really helps young women is shared activities that are not directly related to the issue that they're experiencing. So a shared activity like gardening, shared activity, those kind of things really go a long way for especially women until they reach their late 20s, because those are kind of bonding activities that often they tend to do it with fathers, and but it can really help to do it with mothers, which are not necessarily feminine activities like cooking and all of that.
Right.
So these are the things that I would have said might help feeling heard.
Thanks. Dr. Chitra, anything that you wanted to add to that? Thought you were itching to go.
I think it's also important that mothers and daughters and everybody in the family understand that all lifestyle changes are difficult. They're difficult for across the age group. So it really helps to work together as a team, because sometimes we do get in the way of the other person's attempt to get healthy. And also that small consistent changes over the years will add up, and I know we have Anjum here to explain that to us. And I think one other important thing which Rakhi has explained to us is we might not really need to lose all the weight for many of the features which come with PCOS to get better or improve. It might definitely not very positively impact hirsutism, but whether it is your risk of getting type 2 diabetes, or whether it's your risk of, having regular cycles, all of that do respond to all the changes related to nutrition and activity that you do without it actually translating into weight change. So if you're not seeing the scale move down, it's very difficult to lose weight. Evolutionarily, we are designed to gain weight consistently and continuously and not lose weight.
Right.
So don't beat yourself up. Continue putting the work in. You will begin to see results which are not representative of what you see on the weighing scale.
All right. Thank you. I think we have gone over our time. So any final comments or any final words before I wrap up? Anjum?
Just to add on the point, what is the role of father during this journey? I think it was very pleasant for me because my dad made sure that while I'm going through these laparoscopic surgeries, I had the best facilities. My doctors are really good, and he would convince me saying, this doctor has so many references, after so long I've got his appointment and I'm making sure that we are not compromising. And he was there with every appointment. So that's very consoling. And, if that kind of support system happens, that makes the journey a little more easier than what it is. So my dad played a really good role here, I would say.
Thank you. Thanks. Dr. Tejal?
Yeah, just to close that, just reiterate, it's complex, it's difficult, it's a work in progress, and we have to do it together. Just one person cannot, we all need to work together. And I'm so grateful for this platform where we all are working together. And the reason why I wanted to do this program is because I want girls with PCOS to hear that there are people who care about what they feel, they understand what they're going through, and in our own small way, we're making efforts to make their life better.
Right. Thank you. Thank you, Dr. Tejal. Professor Mahati?
So, I mean, one bottom line I would have said is it's really important for each of us to just ask one another, are you okay? It's so important. And I think that many times we forget that. And then it's also important for each of us to say this to ourselves, that we are loved, you are loved, and you are enough, and I think that is the bottom line message that I would have wanted to kind of put out there.
Thanks. Dr. Chitra?
Yeah, I think at the end of the day, it all I think boils down to being kind. First of all, being kind to yourself and your body, and being kind to your family members. Pause on that sharp thing that you want to say, hold on to that, process it and come back, right? Overall be kind. I think that's the way forward.
Thank you, Dr. Chitra. So thank you to all our listeners, and thank you to each one of our panelists who've come forward and talked about especially the social aspects of PCOS. I think we've touched a lot on that. And a special thanks to Anjum and Rakhi for sharing your experience. I think it's always difficult to talk about some of these conditions, but it is significantly important for the listeners out there. So thank you once again. And to Dr. Tejal's point, I think let us continue to work together on credible PCOS information and putting that out there and seeing what else we can do. So thank you once again, and thank you, Lupin, for supporting this initiative as well.
Is it okay to say that you were a wonderful moderator, and it was amazing to work with you, and we do a lot of webinars, so believe me, you're like up there. It was really well conducted, and you just really got our stories out. Thank you so much.
Thank you, Dr. Tejal.
Thank you.
Thank you, Aparna, and